This is Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for the state of North Carolina. I work for Governor Roy Cooper, and we are working hard to respond to the COVID-19 pandemic. And I'm also a Zetema panelist. We've taken some very early aggressive action here in North Carolina to slow the spread of the virus. Very early on in the middle of March, we took some steps to close schools, close restaurants and bars. And by the end of March, we were at stay-at-home, and we've been at a stay-at-home order since the end of March here. And luckily, we have seen our curve flattening, which is exactly what we wanted to see, right? Slowing the spread of the virus. We are at about 5,000 cases as we sit here in mid-April in North Carolina. We see, slow cases each and every day. We have not seen a decline yet. We still are going up, but our doubling time is increasing, which is good news. We actually think that we're making progress by staying at home. And just yesterday, the governor and I laid out a plan of what's next. We're doing stay at home, and then where do we go from here? And we know that the where do we go from here and trying to stay ahead of the curve, if you will, is going to rely on our ability to really ramp up testing, ramp up our contact tracing work, and then look at our trends, look at our numbers and our data, use that data to inform policy decisions. But also look at our trends in things like protective equipment and our ability to surge our healthcare resources. I think there's a mix of things that need to happen in terms of whether we have full standardization across the country or whether we have regional variation or even variation within a state and how we respond. There are certain things that the federal government needs to help us out with in terms of supply chain. That's been huge in terms of marshaling the manufacturing sector. So those are key roles that the federal government and certainly the CDC providing guidance and at the high level on things that we should be applying to. But North Carolina is not New York. It's not Massachusetts. It's not Chicago. It's not what we're seeing in New Orleans and Louisiana. So we do need a different and tailored response here in North Carolina, and that's what we're trying to figure out. I actually had the opportunity to talk with Dr. Fauci earlier today about our situation in North Carolina to get his opinion, because I think North Carolina is a little bit in the gray zone. We're going to have to look at our own numbers and our own trends, and we may even have to act regionally within the state. So if you're in the Charlotte area or you're in the Raleigh-Durham area, where we have more of our metropolitan areas, we may need different tactics than we need in some of our much more rural parts of our state. So when I think about what role should politics play in responding to pandemics, I think it shouldn't play any role, but that's not reality. I live in a purple state. I work for a Democratic governor, but our legislature, our General Assembly is Republican led. And so I think the dynamics of politics play out as a microcosm here in North Carolina. I want to make sure that we are being led by science and data as much as we possibly can in a time where we don't have as much science and data as we would want to actually lead us forward. We have to do the best we can to understand the new data that is developing. I think there is an emerging consensus on both sides of the aisle that testing is going to be hugely important, that contact tracing is going to be hugely important, and that looking at the data to inform your decision-making is going to be hugely important, as well as making sure that your medical system is ready to surge if you see those cases go up the wrong way. I hope the politics will stay out of this, that we can keep our eye on the ball of trying to do the best we can for North Carolina. But it's always a tension. We are, for example, a state that has not expanded Medicaid. Despite my advocacy for many years and the governor's advocacy, our legislature just has not moved forward. And I think that sets us up to not be able to respond in the same way to COVID-19 as some other states that have a much more full insurance rate. We know that we can't overreact to COVID-19. There are a lot of other health conditions and a lot of other needs that folks have. We know that economic activity allows folks to make sure that they have jobs that give them health insurance and get access to care. We know that they need access to food, and food security is part of your health. So we do have to look at this holistically. So getting the economy back is a health intervention. right? So not just locking down things being a health intervention. So we are trying to take a measured approach to this, to understanding that we can't just focus on COVID-19. We have to think holistically about health, and health and economics are incredibly linked. We've been focused on health equity issues since the time I became secretary. I've been here almost 3.5 years, and has been central to the kinds of work that we've been doing, whether it was a focus on infant mortality disparities or that in diabetes prevention work. We've been focused on inequities, and we're seeing the historic inequities in our system play out in COVID-19. So in North Carolina, African Americans are 21% of the population, but they're 38% of our cases and 40% of our deaths. So, right, we're seeing that disparity right away. We're only 4 weeks into this, and already we see the disparities. So there's a couple of things that we have to do, and that we are actively working on. First is make sure that we're getting the right information and the right data so we can surface the issues quickly and accurately. Then we need strategies to make sure that we are thinking about equity lens in all of our work. So as we think about surging our testing strategy, it means I have to think about our African American communities and where are they, and how do I meet them where they are to get the testing that they need. It means working with our African American physicians, which we have many of here in North Carolina, to use them as a conduit to reach out to our nursing community, to our faith communities. So we're doing all that work. So there's some education work, but then there's just some policy decisions when we think, where are we going to stand up that testing site, right? Are we going to, which neighborhood are we standing it up in? What kind of place? Those are the kind of issues where we need to think through from an equity issue. But I think it's also pointing out, as it goes back to things we talk about so often, is your zip code determines your health outcomes more than your genetic code. And our African American communities live in zip codes that correspond to the fact that they are our essential workers. There are grocery store workers, there are long-term care workers, and they're going out, they have more exposure to COVID-19 than some of our other communities. And I think that as we think about economic recovery and the stimulus, and thinking about who is actually doing the hard work and being on the front line, I think we have to layer in the equity lens from an economic perspective, not just from a healthcare access perspective. When I think about how will our healthcare system change, I think that I hope that there will be ways in which it changes fundamentally going forward for the future. I think it is showing us that we can do way more using virtual care than we ever thought we could. And it has sort of leapt us forward into really exploring what do our patients want, how can we access them, how can we interact with them. I think it's showing gaps both in our payment system as well in our home diagnostic space, and thinking about how do we get blood pressures and vitals taken at someone's home to fill out a full visit with someone. But that's going to be good. And I think we're going to leap forward in telehealth after this space. And I hope that we don't even call it telehealth, it's just health. It's just like how we do business, right? No one calls it telebanking, it's just banking. And then there's some things around licensure and sort of some sacred cows around this state licensed me, this state didn't, and how do we think about those things that I wonder as we move forward here, are those going to be things of the past? And as we go forward, we're going to be like, hey, we need to think about different kinds of solutions to licensure, scope of practice, those kinds of things as we move forward, so that we can get the most out of our highly skilled clinicians that live and work in all parts of the country. I think if we look at health access and economic recovery together, that whole person picture of health, and not just what happens in the four walls of hospitals and clinics, is going to be even more important. So I'm hoping that, again, as we set up systems going forward towards recovery, that we think about that whole package holistically, about housing access, food access, someone's job, and whether they have access to insurance. All those things matter.